Hello everyone, welcome back to my channel. This is Dr. Zina speaking. Today we'll be speaking about what is giant cell fibroma and how to differentiate it from other conditions. So make sure to subscribe down below before we continue. Let's start now. Now let's start with the definition. Giant cell fibroma is a benign, non-neoplastic fibrous lesion of the oral mucosa that is characterized by the presence of large, stellate-shaped fibroblasts, giant cells in the connective tissue. As the name suggests, giant cell fibroma, so giant cells plus fibroma equal to fibroblast cells that are present in the histopathological feature, which I'll show you in a couple of minutes. Now, what are the clinical features for the giant cell fibroma? First of all, it is asymptomatic, slow-growing nodule. The size, it is usually less than 1 centimeter. The surface, it is usually either smooth or papillary, firm on palpation. The color, as you can see, it is the same as the surrounding buccal mucosa, and occasionally it is slightly paler in color. It can be either pedunculated or sessile. Pedunculated means long shape, or sessile, which is horizontally shaped. So these are the clinical features. Now, what are the histopathological features for the giant cell fibroma? First of all, it is fibrous connective tissue with abundant fibroblast cells. As you can see, the ones in the purple are all fibroblast cells, and the characteristic feature for the fibroblast cells are stellate-shaped or multinucleated. The overlying epithelium can be either thin or paraketronized, as you can see, these long things, these are referred to as elongated reed ridges. Plus, there is absence of inflammatory cells, which helps it to differentiate from other bony conditions in which there is inflammatory cells present. Now, what about the X-ray features? It is not visible on the X-ray because this lesion is a reactive lesion. It is not associated with any bony involvement. We can just take an X-ray to rule out other bony lesions like ossifying fibroma or peripheral giant cell granuloma as well. Now, what is the differential diagnosis? First is irritation fibroma. But the way to differentiate, it has less stellate-shaped fibroblast cells histopathologically. Next is the papilloma. Papilloma associated with viral etiology, that is the HPV virus. Next is the peripheral ossifying fibroma, in which there is a bony involvement. Together with the peripheral giant cell granuloma, also there is a bone involvement. And lastly is neurofibroma, in which the fibroblast cells are not stellate-shaped. Now you might ask me, what is the treatment? The treatment is just excision. Conservative surgical excision is the treatment of choice. It will not reoccur back again because it is completely benign and completely reactive in origin. So no need to do any aggressive surgery.